Uh, some of you may know Ronica and Alexandria, who have worked with the OHA extensively over the past little while, and in particular on the COVID-19 efforts, and we're hearing from them too. So without further ado, Kara, off to you.
May I request everybody to mute if you're not speaking? And thank you, Trevor. You can go ahead and push start on that so it goes into the full screen. Thank you. Great. So good afternoon, everybody. I hope everyone's having a great day. Happy Aloha Friday, as we like to say. I would like to give my team an opportunity to introduce themselves. And I first just want to give my utmost respect to Trevor and all of the other team and program leads and staff who are here today. We're very honored to be featured today. And I'd also like to give my respects to our Consul General of the Federated States of Micronesia, CG Enlet, and one of the co-founders of CAN, Lloyd Henyon. And I am Kara, the Executive Director of CAN, and I'd like to pass it over to Lloyd to introduce himself next.
Well, I'm Lloyd Henyon, and I've been doing this work lobbying for CAN for 10 years, and I'll have more to say a little later. Thank you, Kara, and thank you, Trevor.
Did Joe make it? He texted me he's trying to log on, so if whoever is managing that side from your end, if you could make sure there's no one in the waiting room. And can you please go back to the first slide, to the opening slide, and we'll have Ronica and Alex introduce themselves.
Hi, everyone. My name is Veronica. I'm with COFA Alliance National Network, doing contact tracing and resource advocate wraparound services for the COFA community. Thank you.
Hi, everyone. My name is Alexandria Milo. I'm also a contact tracer and wraparound support for CAN.
Great. Thank you, team. Checking, Joe, did you make it?
Yes, I'm here.
Would you like to introduce yourself?
Sure. Hello, everyone. My name is Joe Enlet. I am from Chuk State in the Federated States of Micronesia. I am an advisor to CAN, formerly a board member, and now I'm with the FSM Consulate General Office here in Portland, Oregon. Very good to be here with you all.
Great. Okay, next slide. Thank you, team, for introducing yourselves. So again, Kumotara Kiniso Chapur, we have our Marshallese and our Chukis teammates here today, so I figured I would say thank you in their native languages, in addition to thank you very much for having us. So today we're going to go over a brief history of what the Compact of Free Association even is and what it's about, and some important history that will help you understand our current situation today. As part of that brief history, we will touch on the nuclear legacy in the Marshall Islands and the larger Micronesian region, and this will help inform some of the history around Medicaid for our COFA populations in the United States. That will lead us into a very brief history of CAN. And in part of that history, we will cover the COFA Premium Assistance Program, some important lessons learned from this, as well as the impact COVID-19 has had and is having on our COFA communities in the state of Oregon. And CG will close us out with some closing remarks. And it's very hard to distill all of this history and all of these stories down into one presentation. So I really genuinely hope, and I know my entire team hopes, that this will be the first of many conversations that we're able to engage in with all of you about this. Next slide, please. I love engagement. So please, I know we're on Teams, and I personally don't know if Teams even has emojis. I think it does. But if you feel like using the chat and the emojis, we would really appreciate that at any point during the conversation. We did call this a talk story on purpose. Please ask questions at any point, even while we're giving the presentation, and then we'll definitely have time for questions at the end. So who knows what 3 countries are included in our Compact of Free Association countries? Anyone can unmute and answer if you know the answer.
The Federated States of Micronesia, Republic of Marshall Islands, and Palau.
Yes, thank you. Thank you for the answer. And that is absolutely correct. Trevor, you can click. You can click. So these are our 3 COFA nations. And it's really important to talk about this for just a moment. And if you could mute yourself if you're not speaking, that would be great. I'm hearing a little bit of feedback. So within the Federated States of Micronesia, we actually have 4 very distinct, unique islands, including 4 distinct languages and cultures. So within the Federated States of Micronesia, also known as FSM, we have the islands of Yap, Koshrai, Chuk, and Pohnpei. And all 4 of these islands speak their own languages: Yapese, Koshrayan, Chukese, Pohnpeian. No, if you speak one language, you cannot speak another, not even necessarily understand another. They're very distinct languages, and sometimes we overlump Pacific Islands in general. So I just want to make sure everybody here realizes that we're talking about 6 very distinct islands, cultures, and languages when we say the COFA island nations. So those 4 islands are FSM. And then in the Republic of the Marshall Islands, we have 2 main atolls. They do speak Marshallese throughout the Marshall Islands. And then the third is the Republic of Palau. Now, we tend to call these 3 island nations the Micronesian region to make it a little bit more confusing. So I put this map up here so you can see how the United States has delineated the Micronesian region. So falling into the Micronesian region, you'll see the Marshall Islands, FSM, Palau. You'll also see the Commonwealth of the Northern Mariana Islands, Guam, and even the island of Kiribati down here. So Melanesia, in difference to this, encompasses more of the southern Pacific islands, such as Vanuatu and the Solomon Islands. And then Polynesia, which many people in Oregon and the United States tend to confuse with Micronesia, encompasses more of the islands that we've maybe heard of, like Hawaii, for example, Samoa, Tonga, the French Polynesian Islands. So the Micronesian region encompasses these 3 islands, the COFA nations, and a couple others. Next slide, please. One more map to give you a bigger perspective of where these islands fall in relation to the United States and Hawaii. This region is considered the Northern Western Pacific. So when we talk about the North Pacific or the Western Pacific, you can think of Micronesia versus the Southern Pacific, which would be more Melanesia, and then some of the more Eastern Mid-Pacific being Polynesia. Next slide, please. In general, the bird's eye view of the Compact of Free Association, also known as COFA, is this is a military economic treaty between the United States and these 3 nations that ended these 3 island status as what we used to call the trust territories to the United States. Next slide, please. So in a little bit more detail, the compacts have been revised. So the original compacts, as you can see in my first bullet point, for Micronesia, the Marshall Islands, Palau, began in '86 and 1994, respectively. The current compacts expire in 2023. That's right around the corner. There are renegotiations happening now. With that said, regardless of the outcome of those current negotiations, our United States military has secured their presence to the land, air, and sea space of these islands for at least 30 more years. This is an incredibly unique relationship. It's very important to understand that these are the only countries in the world that have this relationship with the United States. Our territories do not have this relationship with the United States. It's only our freely associated island states, the COFA nations, that have compacts with the United States that give them what's called an I-94 immigration status. They are considered non-immigrants in the United States. They are also not green card holders, and they are not citizens. With that said, they work some of the most challenging jobs that keep our economies alive. They pay federal and state taxes, and they serve in our military at the highest rates of any racial group in the country per capita. So this is really important. These people are contributing to our economies, paying taxes, doing the hardest jobs, serving in our military, giving up their lives. Yet because of many barriers we'll go over, most are not even able to access the health care that they come to the US seeking. There is a very long and complicated nuclear history and legacy in the Republic of the Marshall Islands primarily, and in the larger Micronesian region. And I would like to hand the baton over to my colleague Ronica to tell you a little bit more about that. Next slide, please.
Once again, my name is Veronica. Yahweh. Yahweh in my island means, I am from the Marshall Islands. Yahweh in my island means it's bidding farewell, it's to sympathize and to greet, and also an expression of love. So Yahweh again to everyone. And folks, did you know this is not, this is the first time you've heard this word, this is not the first Marshallese word that you know today. The other word you might already know is bikini, which is the two-piece bikini that we wear today. And that was invented by a French designer because coming out of the one-piece coverall, one-piece suit, it came out two-piece. He expressed it as being explosive, and this is regarding, he's regarding it to the nuclear testing on the island of Bikini in the Marshall Islands. Between the years 1946 and 1958, and one of the bigger Operation Bravo, the bombs that we know, is 1,000 times larger and stronger than the ones in Hiroshima, the Hiroshima nuclear bombs. And even now, the missile testings are still conducted in the Marshall Islands. And this has made our people, the environment not damaging our environment, and also displacing families and the health of the Marshallese people who wanted to return, who are still misplaced from some of their home islands, atolls. The Bikini nuclear test is referred to, we call it our Marshallese legacy, or this is our legacy, the nuclear legacy. And the Marshallese people have suffered the most cancer due to all of these effects on the nuclear fallout and environmental damages. We will now take about 5 minutes to showcase this in a short video.
Take me a quick second to switch over.
In 1946, the Navy pulled into the harbor, the lagoon in Bikini, and went ashore and told the people there that the United States would like to use their atoll as testing a site for bombs, atomic bombs. This very direct approach was well rehearsed. The team that went there to quote, seek the permission of the natives, couched it in terms of something that was the will of God, that it was a call from God for the people of Bikini to sacrifice for the peace and security of the world. So the people left. Aniweta Atoll was also evacuated for the tests. While 67 devices were reportedly detonated in that period, the extent of the nuclear insult, for lack of a better word, the yield of those tests has been estimated at 1.7 Hiroshima shots every day for 12 years. We in the Marshalls, covering an area just under 1 million square miles of ocean, were the direct, like the ground zero, extended ground zero of the atomic bomb tests.
The largest explosion and still the most powerful nuclear device ever detonated by the U.S. took place March 1st, 1954. Codenamed Bravo, it was a 15-megaton hydrogen bomb equivalent to 1,000 Hiroshimas. A miscalculation caused the yield to be about double what was expected. The radioactive fallout blew right onto 2 inhabited atolls downwind. More than 200 people were on those atolls, men, women, and children.
Rongelap is one of the 4 affected atolls by the nuclear testing of the United States from 1946 to the late 50s. The Rongelapese people, not only the land that has been contaminated from radiation, but their bodies and their health is also as affected from the fallout of March 1st, 1954.
National Cancer Institute was asked to determine what kind of cancer burden was generated from the nuclear testing. And in 2004, they came out with a report that said, in the period of time between 1946 and 1958, the people who lived in the Marshall Islands during that time, it would have generated an excess of 530 excess cancers, at least, above the background. And half of those, over 200, because of they take a while to grow, have yet to produce themselves. So it's quite a heavy load.
As bad as the health effects of the testing were, the upheaval caused by the displacement of people from one island to another was even more damaging.
If you take a community away from its land and its lagoon, and you place them in another atoll, the fabric, the social fabric of that community is ripped apart.
The land is where it gives you the freedom to express yourself as you are as a Marshallese person with your traditional culture.
When you move people off their islands where they live to do the testing, you break down their entire community structure. What is the impact on health? You know, the stress issues. You contaminate their lands. They can't grow things that they used to eat. When you urbanize, infectious diseases tend to take off. They get more diabetic because, you know, they're eating a Western diet. All those kinds of things, to me, have actually the larger impact than the ionizing radiation.
Thank you, Trevor. While Trevor navigates back to the presentation, I'd like to just take maybe 10 seconds of silence and kind of let that sink in. So Miss Sanjane Madison, who was featured in that video, is currently still one of the elected leaders for the beautiful island of Ebi, which is the island that many of these displaced communities have ended up on. Ebi is 2 miles long and half a mile wide and has over 10,000 people living on it. Needless to say, the largest missile firing range military installation the United States occupies on the island called Kwajalein is just an arm's length throw away from that island of Ebi, where they still regularly have outbreaks of diseases like typhoid, and there's even still prevalence of leprosy on some parts of the island. So, there's a lot of other videos about this, and if anybody is curious to look at this from different types of perspectives and lenses, we're happy to offer more information on that. It's really hard to watch and hear. So we're going to lighten it up just a little bit by passing the baton over to our co-founder and wonderful lobbyist, Lloyd Henyon, to tell you a little bit of how this history, this unique history, has led to motivation and advocacy by really important people from this community, and how Lloyd has been able to help with all of that. Lloyd, on to you. And next slide, please, Trevor.
Well, good lunch hour, everybody, and thank you, Trevor, for inviting us. It's really a great honor to be asked to give a few remarks, perhaps to the finest healthcare policy team in America. Slide 9, please. So again, my name is Lloyd, and I'm one of the founders of the COFA Alliance National Network, or CAN. It's my honor to be here sharing with you the story of the beginning of CAN. The older I get, the more I realize everything is connected, and the formation of CAN is really no different. For me, the seeds of CAN were planted when I got to know a Marshallese woman named Camila Tarquan, who we hired to take care of my mother. Through conversations with her, I learned about disparities in the treatment of the people here in Oregon from the Marshall Islands that were truly alarming to me. I learned that even though people from the Marshall Islands were here legally by way of a treaty, they were limited to one-year driver's cards. These one-year cards caused them many difficulties with basic things we all take for granted, like getting bank accounts, loans, apartments, and even jobs, because apartment owners and bankers and employers couldn't figure out just who these people were and why their IDs were temporary. I'd spent the latter part of my career working for the Oregon Department of Transportation as the chief economist. Part of my duties were to testify before the legislature in bills and budget items that ODOT had in front of them. Through this experience, I made some really great friends within the legislature and learned how a bill is formulated and proceeds step by step through the committees to become law. Well, after learning about the driver's license issue and the Compact of Free Association that the U.S. had with these three Pacific Island nations, I also learned that people living in the United States under the Compact did not have access to the social safety net that every other person who lives here legally has access to, including the green card holders. Lack of health care stood out as a glaring injustice, and I again was alarmed. How could my country treat people this way? People that were living here legally and paying all the federal, state, and local taxes were not able to be supported by programs or taxes paid for. These people, by way of a treaty, were dominated by the United States, in that they essentially ceded control of all their air, land, and sea space to the United States for defense. And these are also people that committed the lives of their young men and women for our defense because they joined the U.S. military in percentages higher than any U.S. state. These then were some of the factors that inspired me and others to create a new organization to address these injustices. Slide 10, please. So one evening in 2014, a small group of us at a restaurant table wrote down on a napkin the basic organizational structure of a nonprofit that was to be solely dedicated to finding legislative remedies. Remedies for the injustice that the U.S. government had placed on these islanders. The U.S. was ignoring their basic rights of freely living in the United States, rights that the Compact of Free Association seemed to promise, but in practice ignored. We brainstormed the name for our new organization, came up with the COFA Alliance National Network, which we shortened to CAN. We determined that a new organization was needed that was intentionally framed and structured to lobby at the state level in order to enact legislation that would address all of the social and economic inequities that these COFA islanders were enduring. We would first start in Oregon, then organically grow to other states, then finally to the national level. Our mission statement is national in scope, but we believe that action at the state level would provide faster results. Slide 11, please. CAN has been successful in passing 7 bills in the Oregon legislature, all with completely bipartisan support. Among these was a bill to address the COFA Islanders' lack of access to Medicaid. You see, under the original COFA agreements, 1986, COFA migrants were eligible for Medicaid as lawfully present migrants. However, in 1986, due to a federal oversight in an act that included provisions on Medicaid, COFA Islanders were left out. The act became known as the Welfare Reform Act, but certainly there was no moral reform in it for COFA citizens. Over the last 25 years, 19 different bills were introduced at the federal level, aiming to reinstate Medicaid for COFA residents. Meanwhile, the population of COFA Islanders in the states of Oregon has continued to increase by over 300% in the last decade. We knew we had to do something to address this rising tide of humanity being left out of the system benefits. Slide 12, please. By working with Judy Moore Peterson, then director of Oregon's Medicaid program and the Center for Medicaid Services, we determined that COFA Islanders were eligible for Obamacare. It was then determined that if the state would pay for the premium and out-of-pocket cost at the silver level of care, the federal government would pick up the rest. As this resulted in a 90-10% ratio, we were able to pass Oregon's COFA Premium Assistance Program. That was really a big deal and the first in the nation. CAN was also instrumental in getting Medicaid restored at the federal level in 2021. We weren't the only ones, but we were a part of it. I want to give a big shout out to our own Senator Wyden for his help in getting this included in the COVID relief bill of 2020. In fact, he gave us a call right after that. Now let's go over some lessons learned from the COFA Premium Assistance Program in a little more detail. Slide 13, please. While there were strengths of this program, we estimate that we only effectively reached out to about half of the people who were eligible due to the many barriers like language, a general lack of awareness and understanding by healthcare system agencies, and other key players within the Oregon healthcare landscape. There also was a lack of needed engagement to community organizations and community leaders who are capable of assisting their communities in navigating the complexities of the healthcare system. The biggest lesson that we learned is that we all need to do a better job at reaching all eligible COFA people for Medicaid, and once we do, make sure they know what is available to them. Slide 14, please. CAN sponsored many other bills over the years, including a law enforcement bill which allowed COFA Islanders, even though they were not citizens, to get law enforcement jobs in Oregon. Just recently, in the 2021 session, CAN successfully sponsored Senate Bill 553, which gives COFA Islanders in-state tuition rates at Oregon State universities. This was another big deal, as it opened the door to higher education for many COFA residents in Oregon. This is a good opportunity for me to express my deepest gratitude to the Oregon Health Authority for providing assistance for Medicaid outreach, specifically targeting the COFA citizens living here in Oregon. The application process can be difficult for native English speakers and 100 times more for people who are not only don't speak the language, but don't understand how to navigate our complicated healthcare system. Without this assistance, it is estimated that as much as 50% of the eligible COFA residents would not be able to complete the Oregon Health Plan Medicaid application process. And even if they did, they wouldn't know how to negotiate the available services to them. Our last thought. One thing we have learned during this COVID pandemic period in Oregon and throughout the nation is that it is not appropriate to lump COFA Pacific Islanders together with the much larger API community. Their death numbers have been startlingly high. This can be traced back to the type of jobs they have, tight communal living, comorbid factors, low vaccination rates, at least in the early pandemic, but most of all, the difficulty they are having finding healthcare, period. In order to rectify much of this dilemma, our vision is that one day soon, we would see a regional, federally qualified healthcare center located in Portland with a strong focus on COFA Pacific Islanders. This facility would serve multiple states and elevate the general healthcare and well-being of COFA citizens in those states. Let me emphatically say, Trevor, and to all of you, how much we appreciate your interest in learning more about CAN and the healthcare needs of COFA residents. So again, thank you very much for the opportunity to tell you a little bit about CAN, its mission, and our hopes for the future. I'll now happily pass the baton back to CAN's wonderful staff to tell you a little bit more about the impact that COVID-19 has had on the COFA communities in Oregon. So I think, Kara, you can pass the baton.
Thank you, Lloyd. There are many factors that contribute to why our people have been disproportionately impacted during the pandemic. Now that you know about our nuclear and colonial legacies in the islands, you can see why the rates of certain cancers, diabetes, and other chronic diseases are so prevalent in our communities. These underlying health conditions are why many of our elders come to the U.S. seeking medical help in the first place. And when they get here, they can't get most of these help, get into the resources and get medical help that they need due to language barrier and systematic barriers. In our culture, we live in communal societies and we take care of each other. Family always comes first. So when our people are not eligible for programs and services, this is where we turn to family. Thank you.
Next slide, please, Trevor.
So luckily, CAN received support from OHA in the early days of the pandemic to help our people. And we have been able to offer support to our impacted families by helping them access the resources they need, which is a huge challenge for all of them. We have been assisting 6 different counties with contact tracing and overall data collection on the COFA communities impacted by COVID-19. We also offer wraparound support services, including shopping for and delivering groceries to our families in need, and holding culturally specific food drives where we engage in direct outreach about COVID-19 and vaccinations. Hearing from trusted leaders within our community, like pastors and doctors from the islands, is very important to our community. So we are grateful for people like Trevor who take the time to meet our community where they are all like coming to a Chuki's church service to answer questions our communities have about Medicaid. Ronica and I work directly with the OHA Office of Equity, Diversity, and Inclusion on the Get Vaccinated Oregon tool, translating it into Marshallese and Chukis so it will be more accessible to our people. This is a good small step, and there is still so much work to be done to ensure people are able to access the healthcare they need. We are grateful for good partners within OHA for the support. And on that note, I will pass it over to Consul General Joe for the closing remarks.
Thank you, Alex, and thank you all for that great presentation. Um, I don't think that I'm the right person to close after such a great presentation from our community workers here and people who do the work on the ground. But as a representative of our community here officially, I do want to mention how grateful we are to be able to work with people like yourselves here and also OHA and the state in general. Please excuse, I would have chosen a better picture for my slide, but I mean the picture on the left side of your screen. But anyways, let me just say that right now the community continues to be dealing with a lot of these barriers, barriers to well-being in general, because the ultimate goal for Micronesians, COFA Islanders coming to the US is really to raise their families and to seek a better life and to contribute. And a lot of them are doing that. But it's very difficult to be able to do that when we are lost in the mix because of certain policies that just are ignorant of the existence of COFA Islanders, but also very deliberately uninclusive and unequitable. There are so many other different barriers and other difficulties like being invisible, not being accounted for when we do data collection on all different levels of government and social service programs. These are just some of the underlying causes for why many of our people are left out of important and critical services, but also important critical policy issues. And I know this is a policy group. But I also want to talk about the fact that during COVID-19, we have seen really a huge devastating impact on our communities. I cannot begin to mention how heartbreaking it is for me to every single week be signing letters of repatriation for remains of people who die from COVID-19. Every week in the last 4 months, every single week, at least an average of 2 people from our community need to be repatriated back to Micronesia because they've died from COVID-19. These are young people, old people, people who are working, people who are not, people who are educated. It's the whole gamut. And this is very heartbreaking. But when you look at the story and the legacy of, colonialism and the history of nuclear bomb testings and all these things, you can kind of figure out the storyline and understand how all these things are connected to each other and why in so many World Health reports, they report that Micronesia has some of the highest rates in all of the world in cancers, in chronic diseases like diabetes. That is the story behind all of the policies that we're talking about. And also sometimes, even when we get the best policies in place, they still lack a lot of real life connection to the community. For example, access. Even when people have the eligibility to be on Medicaid or be on a certain health program, not everybody gets onto those health programs because they don't understand the process of applying. There's no culturally and linguistically relevant services, or agencies are waiting for people to come to them rather than go out to these people who are dealing with a lot of other barriers that cause them not to be able to come to seek those services. So even though we have the right policies, sometimes implementation is another story. And so I think to conclude here, I'd like to say, let's look at what are the necessary and logical steps after hearing the story, understanding the policy barriers and the advocacy from the community side. What can we, as policy people and people who work for the government of the people, what can we do to further help people? We can get the policies right, but what's the next steps? And Lloyd mentioned one of those things is beyond coverage is providing services through something like a health center that is specifically for that addresses a particular community and the particular need. The other thing I can think of is if we look at the number of COFA Islanders just on the west coast of the United States, it's big. There are about 50,000 on this side, and then another 50,000 when you add Hawaii and the Midwest and the East Coast. There's a total of about 100,000 people from the COFA nations who are in the US. But there's here on the West Coast, we don't know of anyone who's a medical doctor who is from the community, who speaks the language and understands, or even people who are, nurses. It's very few. And why I mention those things is because it's important also to build the capacity, the human capacity of the community, so that they too can also become professionals who are serving their communities. These are some of the recommendations that we have to help continue what we think is the logical step after getting people the necessary and the right health coverage, and also having access to health insurance. I hope that the presentation today could pique your interest to learn more about the community. We, as a consulate, are here in Portland, Oregon. We've made an investment on our part. We established a consulate office. We purchased a building. We're just waiting to do the celebrations to celebrate the establishment of this office. But I think it's symbolic of the commitment from our government and from our leaders to say, hey, we have a community out there. Let's really put in something, an infrastructure there that can serve the needs of our communities. And hopefully, we can see the same types of investments from the local government and the local leaders here, because when we work together, then I think we can help our people to survive, to thrive in this community. Thank you very much for having us all here, and I thank you for giving me some time to speak to you today.
That concludes the presentation that we prepared for all of you today. So I hope that it was informative, and I hope that it's the beginning of many continued conversations, and we would love to answer any questions and engage in some talk story about anything you want to talk more about now.
This is Trevor. Just really quickly, thank you very much for your time and energy to prepare and then obviously present today. It's just, I've learned more yet again whenever I work with you and the CAN team. I always get to learn more, and appreciate very much, Joe, your closing remarks, and appreciate you very much taking the time out of your busy schedule to provide those closing remarks. I saw one question, but I think actually Joe answered it in his conclusion, which was about how many people from the COFA nations live in, was it Oregon, or was it just generally the country? Well, let's just go through the.
We estimate 10,000 in Oregon.
Okay. Yeah.
But it's growing rapidly every year.
Yeah. How about another question? How many other states are COFA residents eligible for Medicaid?
So I did write a chat response to that, but I'm happy to speak to it for anyone that doesn't have access to the chat. So it is correct that Medicaid eligibility for our COFA residents in the United States was restored at the federal level at the end of December 2020. Lloyd mentioned that we received a personal phone call from Senator Wyden, who was on the Hill in that moment when it was signed in that COVID relief bill. So we were very, very grateful for that, and it was a long time coming and much overdue. With that said, it's really important to know that not every state has an expanded Medicaid program. And some of the states that don't have expanded Medicaid programs have very large populations of COFA residents living in their states. So when it comes to advocating and supporting our people on the national level, it really does require a very state-specific approach. And a lot of the times, it does require that state to do something specific within their own health policies and regulations to address some of these gaps and some of the lack of services. Of course, we advocate for expanded Medicaid for all across the country, but it is unique in terms of informing our overall advocacy approach in other states that don't have an expanded Medicaid program, even for their citizens at all. Hope that helps.
Anybody else have any questions? So all right, I'm going to stop sharing and go back to, so we can see each other, or at least I can see all of you. Don't be shy. Anybody have any questions for our presenters? Well, if there's no questions, I think we can, again, just thank you so much for your time and the energy that you've, oh, Lloyd's going to say something. Of course, we have to.
Trevor, I just wanted to say that one picture you were showing was the Joe's president of the Federated States of Micronesia, and he graduated from Eastern Oregon University, so he's also got Oregon roots.
Very nice. Thanks for pointing that out.
President David Penuela, and when he comes here, we will make sure you and others get to meet him.
Thank you.
Joe will make sure of that.
There's another question coming in on the chat, and what are your top next COFA related policy priorities for Oregon? Good question.
Very good question, Laura. Thank you for all your questions today. And Lloyd, I'll let you speak to that one.
Well, one of the biggest considerations, I think, is solving this I-94 dilemma that people have. That's one of the things. That's because that continues to give them all kinds of problems. And the other one is really a central place where they can get all kinds of health care that they need. And that's going to take, I think, the healthcare center that we've been talking about. And so if we can do that, that could be an example throughout the United States and other regions. And so I think I do know that we're going to get some support from our congressional offices on that. And maybe we could even get some support from the Oregon healthcare community, policy community. I'm just saying, it's possible.
Yeah, Kara makes some good points too.
Well, she always does.
She always does, yeah. She always does.
Veronica and Alex, what would you say if you would like to say what some of the next important policy areas that we work on for our communities would be?
Access to the safety nets, like rental assistance and SNAP. Yeah. Anything from you, Veronica?
Yes, those are right now during the pandemic, that's what we are helping with wraparound services to families that were affected by COVID, and just getting food. We're not eligible for a lot of those, so that's one of the things that those benefits, simple ones that we would like to see happen.
I forgot to mention one of the most important one is housing. Housing is really critical because right now we have tight communal living spaces, and that ends up working with the financial sector and getting loans and getting people qualified for loans and their own individual houses.
Belle asked a great question. Can you say more about health impacts that the COFA population experiences, also to help inform policy?
CG, Joe could answer that one really good.
CG, would you like to speak to that one?
Oh, sorry, what was the question?
Can you say more about health impacts that the COFA population experiences, also to help inform policy?
Yes, well, I think the health impacts are, many of them have been mentioned here, because access has been the issue for decades. People don't know how to even call, their doctors and be able to set up an appointment. And education is a big part of it, because people don't think that they need the doctor if they're not necessarily sick or having a stomach ache or something. Their only experience has been going to the ER. That's their whole conception of the health system. So being able to navigate the health system, I know this is, I'm preaching to the choir, but this is very true for a community that's hard to even organize because there's 6 different languages, or even more within the Micronesian COFA community. So one translation will not help, everybody. It'll help just a few people. But In terms of the policy, I think right now we have to be looking at the level of getting people out to educate folks how to use their benefits, and also being able to go and help them navigate. So again, we do jump on the bandwagon of community health workers, culturally specific trained community health workers who are from the communities. That is also a really huge help. That's what I can think of at the moment. Thank you, Lloyd.
Well, I know everybody has to finish up their lunch now and head back to meetings and work. I just want to take the last opportunity to thank you all very much again. Thank you. Look forward to continuing our work together.
Thank you.